My name is Allie Orwig, and I'm from the Indiana Rural Health Association. We appreciate everybody joining us today. Just a couple quick housekeeping items before we get started. If you're not actually asking a question or doing the presentation, we ask that you mute your line. It helps cut down on background noise and improves the flow of the presentation. During the program, if you have a question, we're going to be utilizing the chat function. And I'm just going to send a quick one to everyone so you can see where that is and how that looks. I will try to moderate those. Other than that, if you want to hold your questions until the end, then you can ask them verbally. We do appreciate that. We are recording today's session, and we'll have that available on our YouTube channel if you would like to share that with anybody or revisit today's presentation. And without further ado, I think I'm going to go ahead and turn it over to Scott Yancey with On Target Health. Scott?
Allie, thank you very much, and everyone, thank you for joining. I look forward to talking to you about something that's near and dear to our hearts, and that is obesity. And during my presentation, I'm hoping to dispel a few myths that are out there and give you an idea as what needs to be done in order to reverse this trend. First of all, we have a health crisis in America, and that health crisis is obesity. The obesity rates in Indiana are rather surprising. Looking at this map, I show 1990, where the obesity rates in the state of Indiana were just 13%. The color there, the aqua color throughout the United States, shows an average BMI somewhere between 10 and 15%. Look what happens over time. In just 13 years, the obesity rate in Indiana has doubled. And then moving forward to 2017, the obesity rate has increased to 33.6%. Those are people who are obese. In addition to that, we have another 30% of Hoosiers who are overweight. So we have some real issues that are happening here that we do need to address. If nobody intervenes, what's going to happen? Let's talk a little bit about the economic impact of excess weight. And I've looked at a lot of stats, so take them with a grain of salt. But this is from Milliken. And what it says is over $7 trillion. If we look at it a little bit closer, look at when they're working with our company. But my point here is that there is a significant amount of money that is spent on indirect costs, such as workman's comp, absenteeism, presenteeism, short and long-term disability. Did you realize that about 70% of your annual healthcare spend comes from conditions related to obesity? And with healthcare costs going up the way they are, it's just really quite an impact. Many of these conditions, most of the common chronic conditions, are also the most avoidable. Conditions such as type 2 diabetes, heart disease, hypertension, metabolic syndrome, stroke, sleep apnea, and cancers, those are all treatable if we can improve the health of participants by reducing the amount of fat in their bodies. Scientific research has shown a correlation between high levels of visceral body fat and an increased risk of chronic diseases. So visceral body fat, that's our enemy. And when you look at this diagram, the visceral body fat is the fat that is around people's organs. And what happens, there's inflammation there, the organs run less efficiently, and it really leads to many of these chronic conditions. So if we can get the body to burn that visceral body fat, we will improve their health. What causes obesity? I think we all kind of know this, but obesity is generally caused by consuming more calories than you burn off through physical activity. What happens is the excess energy is stored in the body as fat. Pretty simple. So what do people do when they're feeling overweight or obese? Well, they diet. And a lot of people's diet strategies are, I'm going to eat fewer calories and I'll lose weight. That's pretty much the diet. We have all kinds of options out there. You've got the keto diet, the Atkins diet, Weight Watchers. There's a new diet coming every 6 months. Unfortunately, the diets aren't sustainable over long periods of time. In some cases, like Weight Watchers, they require people to spend money to get the right food in there. But it's very, very difficult to stay on course. And as I mentioned, people get on them, they get off of them, their weight comes back. And I think a lot of that is probably because there's very few of these programs that get people to change their behavior. We feel that there's just really a lot of mixed messaging. America would like to improve their obesity rate, so they would like to look better. We have tons of healthcare facilities that people are using. We are all those diets, but nothing really seems to stick. And I think it's because of the mixed messaging, and I'm going to try to dispel or at least point out a couple of those that are out there. First of all, calories. Calories are the total number of calories a person needs each day is impacted by a person's age, their sex, their height, their weight, the amount of physical activity they have. Even if they're losing weight, it'll impact it. But nobody really knows exactly how many calories they should be taking in many cases. Estimates are on average, and there are no average people, everybody's unique, but estimates range that a person should take anywhere from, a female should have anywhere from 1,600 to 2,400 calories per day. And men should be 2,000 to 3,000 calories per day. I want you to remember that. We're going to come back to calories when I show our solution, but it is saying here that a male should have 2,000 or more calories per day. There are tables that I've produced. Here's the chart for males, but again, body mass index. And that again is another average. It's a number. It's kind of an indicator, but it's not really a true form of measurement for a person's health. And when we look at it, show a couple of examples, but these are two examples of illustrations with a 32.6% BMI. On the right, person looks much different than the person on the left. We run into this a lot when we talk about a pro athlete. This is an example with people with the same BMI, just happen to be male versus female. But on the left, maybe that's an athlete, and the BMI says they're obese, but they're really not. They're probably very, very healthy versus the person on the right who looks less healthy. So my point here is we're looking at one of the wrong things, which is BMI. We should probably be looking at something else to tell whether or not a person has a healthy amount of fat in their body. This is the chart that they put out for BMI. Another thing that we all do when we're losing weight, and we're all very excited about it, is we get on the scale. Well, I'm here to tell you the scale lies. The number that you see when you get on the scale doesn't tell the whole story. You may have lost 10 pounds. You may look better, but in the long run, you may be less healthy. And as we talk about our solution, I will relate back to that. As I mentioned earlier, all the diet plans that you see out there for the most part produce some results for a period of time, but long-term sustainability is difficult. And we feel the main reason for that is we've never modified the person's behavior. So why would we expect anything different to happen once they go off the diet? At On Target Health, very simply put, we work hard to make people healthy. We do this by attacking the root cause of the chronic conditions in obesity. And that root cause really is fat and inflammation in the body. We do this with a high-intensity, comprehensive lifestyle intervention program. This is really key. If you're going to modify people's behavior, if you're going to get them to change, you need to come with something like this. Our program, we take a physiology-based approach to losing the right type of weight. You can't trick the body. The body is very, very smart. Fad diets don't typically work. So we take, as I said, a scientific approach. Our patented method has been studied by Ball State University. It's also been published. Here it is. Here's a look under the hood. A person's metabolism is the foundation of fat elimination, and everybody's metabolism is unique and it's ever changing. We measure a person's resting metabolism with a device called a calorimeter. A person would sit down in a relaxed setting and would breathe into this for 10 minutes. And based upon that, it will produce a person's required caloric intake for a day. And from that, we will run those results through a proprietary algorithm that's going to help us establish 2 calorie levels. One would be called the targeted calories, which is the maximum amount of calories we want someone to eat in order to burn 100% fat. And the second one is the danger zone. And the danger zone is the amount of calories we want you to eat more than. So we're really going to give you a range of calories. In this particular example, this is a report. This is a male. This person's caloric range was 1,704 calories and 1,503 calories. Now, if you remember back when I was saying what was recommended here in the United States, it said a male should be eating 2,000 calories a day. Well, if I'm following the guidelines and doing the best I can and eating 2,000 calories, I'm actually going to gain weight. I'm going to have fat because I'm eating more calories than my particular body would need in this example. And as I said, everybody's caloric intake levels are different, and an individual's caloric intake levels will change over time. Little different look at the key to fat loss, but it is staying in that range. Let's talk about the biggest loser. Think about this. A lot of people do wellness programs, and when they're doing the wellness programs, they'll offer a biggest loser competition, usually right around January, with the goal of, let's see how much weight we could lose. What happens is some individual really go overboard, and let's think about those numbers that I showed previously. That person who needed to eat at least 1,500 calories a day suddenly is eating 1,000, and they lose weight. But what happens is the body goes into starvation mode. They end up losing the wrong weight, which is lean muscle, as opposed to losing the right weight, which is fat. So that person might look better, but in essence, they're going to be less healthy. And I'll explain that in a future slide. But that's what we do here quite often, is this biggest loser. And I just wanted to mention that that's one of those things that I don't think is going to improve the overall health of your population. To validate our fat loss, we use a piece of equipment called the BOD pod. And the BOD pod is the gold standard of measuring a person's body composition. This is what we're going to use in lieu of BMI to measure the health and fitness of our participants. The BOD pods you may see at hospitals. They're at the NFL Combine. It's a piece of equipment that a person actually gets in. And when they're inside of there, air displacement is used to measure the amount of fatty tissue in the body and the amount of lean muscle. It is very, very accurate. We test a person's body composition twice per month. So it's really a great way to verify results. This is an example of what our body composition report would look like. In this particular case, the person has 22% body fat. What we are trying to do when people are in our program, and when we mention in our program losing the right amount of weight, we're going to use body composition to get us here. We're going to look for people who are in the red or orange areas, and we're going to work hard to help them burn 100% fat to get into the healthy range. That's pretty much how it works. Obviously, age and gender have an impact on the amount of body fat percentage that is healthy, but there it is. to further help you understand it and think a little bit about my description with the biggest loser, but if I had an individual who weighs 200 pounds, and in this example has 100 pounds of fat in their body, so they're at 50% body fat percentage. This is something that you will see out there. The person gets on a diet, loses 10 pounds, feels good. People at the office might notice he's lost a little bit of weight, but he may have done it by starving his body. And in this example, that's what the person did. So they didn't burn fat, they burned lean muscle. And in the long run, what occurred is the fat percentage in his body went from 50% to 53%. So in essence, he's lost some weight, but he's made himself less healthy. And think about taking that to a more extreme level. Someone might have started a Biggest Loser challenge with only 35% body fat. And when they were finished, they could possibly have won the competition, but increased their body fat percentage to maybe 70%. And that creates now all kinds of health issues. As we're doing all the science with our program, on a parallel path, we have to modify people's behaviors. The approach that we take is methodical, purposeful, and sustainable. It's really what we're going to do for long-term success is to modify the behavior. We use personal coaches. Our coaches have one-to-one relationships with participants. We meet with them every other week. And as we're working with them, we are going to educate them on things such as stress management, getting more sleep, and also on nutritional intake, and also trying to teach them how to count their calories and things like that. Not everybody's ready to jump in the deep end on modifying these behaviors, so it's important to meet people where they are on their journey, and as we get to know them better, move them forward to developing better habits to ensure that we have long-term success. When we motivate people, what we have found is if you can understand an individual's intrinsic value, you're going to be much more successful than if you use extrinsic rewards such as cash. And intrinsic value are the things that mean the most to you. So one example that I would have is I had a lady who's in the program and she wanted to look good for her daughter's wedding as she went down the aisle. Had another individual who wanted to be able to play with his grandchildren or even be part of the grandchildren's lives. And he knew that in order to do that, he needed to lose some weight to improve his health. If we can identify a person's extrinsic value, we'll have a lot better way to keep them motivated. And again, everybody's is different. On Target Health has a mobile portion to our program, and that will give people anytime access to the program. Within the mobile application, we have the ability to chat with your health coach. So if you're away from one of those bi-weekly meetings, you can certainly reach out to your coach. You can keep track of your calories. You can plan meals. And we have videos that if you love the keto diet and want to see if that's something that can work with your program, we address it with our informative videos. We're constantly trying to educate people and keep them on track to modify their behavior to produce long-term results. One of the times I was talking with my health coach about, do we plan meals for people? And the answer is no, we don't plan meals for people. We teach them how to plan their own meals because we're not going to be here forever. Specifics of our program. If a company would like to do our program, first of all, it is typically done with larger employers that have a population of 25 or more participants. It is an on-site program. We bring equipment and health coaches to the location. Our program is broken into 2 phases. The 2 phases are 6 months each. The first phase, we do some pre-planning with the employer. With the employer, we're trying to decide, are we going to involve employees or employees and spouses who are on the plan? Are we going to ask the employees to contribute towards the cost of the program? Some of those fundamental things. Then we're going to move to a marketing campaign and a selection process. The marketing campaign would look something like this. We'll start out with a voluntary group meeting, after we have the group meeting and tell people about, we're bringing a healthier environment here, we're going to try to improve your health through a unique program with On Target Health. If someone's interested, we'll then measure their body composition in the bod pod. It'll be the first time they'll see results where a person who is 175 pounds may find out that they really are healthy, or they may find out that they aren't particularly healthy based upon the amount of fat percentage in their body. As they receive their results, they can apply to the program. And when a person applies, we're going to get a health risk assessment. And we're also going to do something really important, is measure their readiness to change. We want people in the program, since this is going to be an investment, to be the people that can produce the best return on that investment for our company that we're working with. Once that is all done, we'll score the participants and make our recommendations for the selection process. So an applicant scoring might look something like this. This is everybody that was in the testing phase. People towards the bottom were less healthy. People towards the top were the healthier group. Over on the right, we're ready to change. Left, not ready to change. So really, who do you think we're going to select? And I hope the answer was obvious. We're going to look for the people who are less healthy and more ready to change. Over time, people who weren't ready to change may move this direction, and we also may start picking up some of the people who are healthier but ready to change. So there's always an abundance of people who could participate in the program. It's a financial consideration that comes into play. Now that we've gone through the selection process, we're going to be off and running with our campaign. Our campaign looks like this. The first day of the campaign, we're going to do biometric screening. We'll do a lipid panel and A1C test. We're going to get you in the calorimeter to measure your metabolism. We're going to have your body composition measured in the bod pod, and we're going to begin coaching. Every 8 weeks, we will repeat that same procedure. Every other week, we were going to have the participant come back in and measure their body composition in the bod pod and continue coaching. As the coaching continues, we're going to be able to go a little bit deeper and a little bit further down the road with the participants. At the end of the first 8 weeks, we will do a second biometric screening, and we will then be able to provide a written report of some of the results that we get. Our program is unlike any other wellness type programs because we're delivering measurable results. We want to show them frequently. So every 8 weeks, we're doing that. And at the end of this 16-week campaign, we're going to bring another report and have a success review. And the whole idea here is we've been working with you now for 6 months. Hopefully you've seen some very positive results. And if you have, let's continue. And if you haven't seen positive results, then we'll pack up our things and we'll leave. That never happens, but it's an offer that we're prepared to make. Once we get into the second phase, I just show the same cadence that we were doing during those 16 weeks. It's every 8 weeks, rechecking your metabolism and doing the blood work, and then the bod pod every 2 weeks and coaching every 2 weeks. It just continues on. What you'll see with participants is there's going to be a reduction or elimination in medications. Also, medical claims will go down, and we're really trying to avoid those costly hospitalizations. Another side benefit is people become, I think, a little more excited and happy, but also more productive at work. Jump into some of these results. These are individual results. These really aren't selected out of the norm. They're just to represent some things that have happened. This particular individual was hypertensive, and in being hypertensive, we got him into the program, and we were able to improve his health significantly. He lost 65 pounds. He improved his body fat percentage from 40% body fat down to 18.1. We moved him to healthy. This is a perfect program. He came off his medications and even improved his A1C level. In essence, all of the key risk factors have been improved for this participant. This is another example of a lady in our program who was pre-diabetic. When she got into our program, we were able to help her lose about almost 60 pounds of weight. Her risk factors, all of them improved, but the one I want to point out the most is that her A1C level dropped 0.5 of a point. And it's very difficult to improve A1C levels by 1/10 of a point, but we did it 0.5, and we were able to get her off her metformin, and she's feeling really good about it and very, very happy with what we've done. It's very common for us to take pre-diabetics and move them to normal. That's one of the things that people are looking at when they're in our program. This is an example of a company that we're working with after just 16 weeks looking at some of these risk factor improvements. But as you can see here, for the diabetic population, we improved the A1C levels in 29% of the participants after just 16 weeks. Cholesterol levels, you can see the numbers here, but all of these were improved significantly. And these last 4 risk factors are the ones that are associated with heart disease. So you can see we're moving the needle, we're making an impact. We try to show the return on investment. So this would be an example of our ROI calculator. In this particular example, I put some numbers in here, but it would show that we could attribute over $200,000 in medical savings by participation in our program by moving people from abnormal to normal levels on those various risk factors that I shared. It is also said that when you look at multiple risk factors, if I'm able to move a person who is pre-diabetic to normal, that would be 1 risk factor. If I move in triglycerides and cholesterol levels, that might be 2 more. But if you can move a person to normal in 3 risk factors, I should get credit, which I rarely do, for avoidance of a hospitalization. And in that scenario, if I can avoid hospitalization, that's on average $62,755. When I look at this group, there are 36 people who we were able to move 3 risk factors or more. And if I calculated that out, that's over $2,260,000 in savings. So that's the big picture that we're trying to achieve. We're really good at helping people burn fat. One of our clients, Hillebrand, has been with us for 4 years, and we've helped that group lose a total of 6,000 pounds. Only 12 of it was lean muscle. The other 5,988 pounds is fat. We've made that population more productive. We've made them healthier. Another unique factor of our program is sustainability. Remember, we are teaching people how to understand their body, how to eat better, how to count calories, and we're modifying their behavior. So we're able to have our participants maintain their targeted weight 80% of the time. Some of the clients that we work with here here are Hendricks Regional Hospital, the Indianapolis Airport Authority, Jasper Engines, Hillebrand, school systems, fire departments, municipalities. All of these companies have benefited from our program. It doesn't really matter if you're white collar or blue collar. We all have some of the same issues to deal with, which is stress and weight and nutrition. And the ultimate result of a lot of that is excess weight, and we can turn it around in really any individuals, especially if they're ready to change. On Target Health also the state's desire to reduce the obesity rate. So we're really very proud of that. Thank you for your time, and if there are any questions, I would be happy to address them.
Well, I don't have any questions that have been typed in yet. If anybody has any verbal questions they'd like to ask, we will go ahead and open up the lines at this time. And I also want to draw everyone's attention to the chat function. We've shared a survey link with you. This is just a post survey that we have to complete to be able to have these free educational programs. They literally take 60 seconds or less. to fill out that survey, so we would appreciate it. And if you've not let us know what facility you're attending on behalf of or organization you represent, please do that in the chat window as well. Any questions for Scott? Okay, well, hearing none, Scott, we'll go ahead and thank you for your time and presentation today. Very informative. Again, this is recorded, so we'll have it available for anybody that would like to see the presentation again or share with any interested parties. We'll go ahead and stay on the line for just a minute more to let everybody get that survey link and let us know where you're attending from. And then we will go ahead and close the session. Thank you.
Thank you.